Welcome to another episode of Stories from the Edge of Life. We have another special guest today, Dr. Murali Naidu. Welcome, Dr. Naidu.
Thank you. Great to be here.
Great. Dr. Naidu, would you mind introducing yourself to our audience, please?
Absolutely. I'm a general surgeon. I practiced for several years in California and throughout the Northeast. And recently, over the past several years, I've transitioned to administration. So I have an opportunity to help take care of patients in a slightly different way. And when you reached out to me, I was just excited to be able to share some of the stories that I have been a part of, had the privilege to experience over the course of my career so far.
Great. Glad to have you here. And I'm Parag Bharadwaj. I'm a hospice and palliative medicine physician. So let's get going. So what made you want to become a doctor?
Well, it's a great question. And when I was an elementary school kid, one of my very good friends at the time, his dad, who was a cardiologist and had just recently finished his training, ended up being diagnosed with brain cancer. And I remember thinking how unbelievable it was that somebody who was first so young and second had the access to really the top neurosurgeons in the country, if not the world, could still be facing such a daunting situation. And ultimately he passed from the disease after a fairly short period of time. But it really it really made a lasting mark on me, and it made me want to go and try to fix things. So it appealed to my already growing nature to fix things, and really brought the healthcare system and medical care specifically into the spotlight.
Great, and thanks for sharing that. And what made you choose surgery in particular, and why a surgeon of all the disciplines?
Interestingly, I actually in medical school thought I was going to be a pediatrician. I really enjoyed taking care of kids, and what struck me about caring for kids was their tremendous resilience in the face of some really serious situations that we saw. I was at UCLA as a medical student, and the care that was provided there was really very high level of care. So some of the kids were quite ill. But in that experience, I also spent a fair amount of time in our pediatric intensive care unit, and I noticed that I was drawn more to the patients who were post-operative. And I made some wonderful connections with patients and their families who had had heart transplants and other really very amazing procedures. And so I decided to go down that path, and it appealed to my desire to actually fix things with my hands, but also gave for me the opportunity to be able to still take care of kids, just not as a pediatrician, as a surgeon. So I shifted gears and applied to surgical residency, and here we are today.
Great. So tell us, give us a glimpse of a typical patient that you would perform a surgery on, because it is a vast field. So yeah, just give us a sense of the patient population you got to operate on.
General surgery is an amazing surgical specialty in that you can take care of really the entire age spectrum. And so from babies to the very elderly, there's really a need for general surgery for many things that can happen. And then within that, general surgery encompasses things like trauma surgery, which tends to be younger people who've had untoward accidents occur. And then certainly, we've got the diseases that become common as people get older, things like cancers. And some of the most amazing things that I've had the privilege of doing is cutting cancer out of people. It's a very difficult time for people, and those procedures are often today life-changing in that they can be curative in combination with some of the other treatments we have available.
Great. So surgeons perform elective surgeries, meaning planned surgeries, and then there are also emergent surgeries, or the emergency situations. What kind of scenarios? Can you share some of the scenarios where you had to perform emergency surgeries on patients, please?
Sure. You know, the vastness of general surgery means that I've operated on people who have come in with gunshot wounds. I've operated on people who've been in car accidents, and a lot of times those surgeries are surgeries that you have to do immediately when they come in. And by the way, that makes it for sometimes really good TV drama, which is why a lot of TV shows seem to highlight those types of things. And then we have patients who come in who have things that are impacting, for example, their intestines and putting the intestines at risk of dying or getting a hole in them, perforating. Those are emergent surgeries that are really important because left unchecked, those become life-ending diseases. And really everything in between. Emergent surgery is now starting to become a field of its own because it requires a lot of time on call, and that's something that is not easy for people to do mixed in with having an elective practice. But it also means that you get a lot of experience doing some of those really complicated procedures, and you hone those skills as well.
Great. So I'm sure you've come across situations where time is very critical when it comes to saving a patient's life. How do you keep calm during those situations?
For me, it's really about staying focused on the work at hand. And that's, I mean, people talk about compartmentalizing, and it's really, I think, important when you're operating on somebody to be thinking about specifically the operation and what you're doing and what the goal there is, because it's a very defined goal usually. And staying focused and doing that as well as you can is very key. But that said, it's also really critical to then be able to take a step back and think about the human that you're taking care of. One of the challenges in healthcare is that you can fall into this trap of really just focusing on a disease or the care that you're providing. And so I'm always encouraging people to think about the person and what is the person's goal, and making sure that our goal is driven by their goal. So, when you think about emergent surgeries, as you were talking about, that's often very clear. And it's important to be able to step back and to have the empathy when you're talking to the family and, circling back and talking to the patient, and step out of that compartmentalized state that's, at least for me, necessary to be very focused on the surgery at the moment of surgery.
Great. Now, when you're performing a surgery and things start going south, um, of course, you said there's a clear focus, but at the same time, you're sort of orchestrating everything that's going on in the OR as well. And it can get pretty chaotic, right? You have all those monitors that could go off, and you have other people who might be working on a patient. So when things start going south, how do you orchestrate everything? Because you of course have to focus on the surgery, but then you've also got to focus on everything that is going around, which can be very chaotic.
It can. And, the key is to make sure that first you've got the right people around you. And so, sometimes that means making sure that you ask the anesthesiologist to call some extra help if there's a lot going on and they need an extra set of hands, if they haven't already done that. It's similarly the case for the circulating nurse in the operating room, making sure that if they need an extra set of hands, that somebody is being called. And then staying focused on the task, but making sure that where I do need to be engaged in some of the other conversations, I am. And it's a skill that comes with practice, right? I mean, it's really being conscious of everything that's going on around you, but really only interacting with that which is essential for you to be a part of, for me to be a part of.
Great. Now, I know surgeons work very hard. Do you recall what was the longest surgery you've been a part of?
I've done a few 16-hour surgeries. Those are pretty long. Those can be tough.
So 16 hours, you're in charge, and your focus has to be razor sharp.
That's right.
Amazing. It's amazing what the human body is capable of doing.
Absolutely. And that's the key, right? So, because I'll tell you, when you step away after a surgery like that, you feel all of the fatigue and hunger and everything else that for 16 hours you've pushed away because you're so focused, so intent on the task at hand.
I'm always envious of surgeons. So,
Well, I don't know about being envious, but that's very kind of you to say. I mean, right? It's true throughout medicine and everything else. As humans, we have a tremendous capacity to be flexible and it's grueling. I mean, long surgeries are grueling. There's no two ways about it. But it's part of who we are. That's what makes being a human so special. And when you're doing it to take care of somebody else, it in many ways can be even easier because it really is something you're doing to save somebody's life.
Very well put. So, over the years, with all the patients that you've taken care of, are there any particular patient scenarios that come to mind that were unique or made an impact on you in particular?
Lots and lots of them. I mean, I think we all have memories of patients that stood out in our mind for one reason or another. And that's no different for surgeons. I can think back to, I mentioned my time in the pediatric intensive care unit as a medical student, where I realized, well, really, surgery is the thing for me. And there was a young lady who had been waiting for a heart transplant. And I remember very clearly the night that we got the call that she was going to get a heart, and all of the emotions that come with that for her, for her family, for us taking care of her. Obviously, if a heart is available for a transplant, that means that unfortunately somebody else has died. And so I remember that young lady, and I remember her family very well. And she thankfully did phenomenally after that, and lived a wonderful life for many years after. But I remember outcomes that were also really awful, and you remember those, and you never forget those. You never forget talking to a family and telling them that a loved one has passed away, and it's, especially when it's unexpected, it's even harder. Not that it's easy when it's expected, but that happens particularly in trauma. I can remember some trauma cases where it just was heartbreaking for all of us.
And so how did you and other team members cope with that situation?
Thankfully, in medicine, we've gotten better about this and realized that it is important to take care of the team that's taking care of patients. I'm thankful that we do things like debrief, and we take the opportunity to check in on people. And, for me, it allows me now as an administrator to ask how people are doing. And, if a patient has a bad outcome, or if there's a code blue, and, all the things that happen in hospitals, to be able to go back and say, let's make sure we debrief about this, and what support does the team need, because it's very important. I remember you accumulate these things, right? This is these memories, they stick with you, as I said, And so, I mean, I remember days where things had just been rough over and over. And I remember, you know, I knew which stairwell to go to and just sit on the stairs and take a moment for myself because it was just too much.
Thanks for sharing that. Dr. Naidu, you said that you've made a shift in your role, or you've changed, the role that you have professionally now. Could you enlighten us in terms of how do you overlap your current role with you being a surgeon?
You know, one of the things that's fascinating about American healthcare is that the healthcare system is largely led by people who don't have clinical experience. And quite by accident, which is often how it is, I started to take on administrative responsibilities, leading committees, and ultimately leading perioperative services. And so over time, my clinical responsibilities had less and less time available for them. And so now I'm full-time administrative. It's not a transition I ever thought I would make. And that's because I really, really enjoy taking care of people directly as a surgeon, as a physician. For me, what I've learned over the course of this transition is that I still get to take care of people. I just do it in a different way. And it's, really being able to take care of the staff. And, we talked a little bit about that, but making sure that they have the support they need to be able to do a great job taking care of people. And then to hear from patients and hear from how we're doing a better job, how we could do a better job taking care of them, or how we're doing a great job taking care of them. So in some ways now I take care of people, but I do it at a larger scale. I can only operate on one patient at a time as a surgeon. And here I get to bring that experience and that knowledge to a larger group and support the teams that are taking care of people. It's something that is very different, obviously, but it's something that I think has a lot of value. And in particular, most of US healthcare is delivered in the community hospital setting, where it's very unusual to have clinical leaders, as I mentioned. It's a little bit different in academics. Typically, academic systems are run by physicians or in some cases, nurses. But outside of academic medicine, having a nurse or a physician run a hospital or a health system is pretty uncommon.
All right. And congratulations with making that move. And I think you bring up a great point. You're making an impact for a larger patient population than as a surgeon.
Well, thank you. I certainly like to tell myself that. It's, I mean, it is just a real privilege to be able to do this work, as you know well. And I mean, you've just from this forum, you've heard many great stories. But having known you now for several years, I know you've heard these stories directly from patients and their families. And so it is a tremendous privilege, whether we're in administration or directly providing care, to interact with people's own personal stories in a way that is life-changing for them.
Thank you. Thank you. And just curious, now that you are in a different role, what did you like most about being a surgeon? Or what do you miss the most?
I miss being able to just take care of people in a way that solves their problem in a pretty short period of time. I found the operating room to be really a very special place. Sure, as you mentioned, it could be chaotic, but the vast majority of the time, the operating room is a very well orchestrated place in the hospital. And that opportunity to always strive for the perfect, most efficient operation, to me, was and always will be just very exciting.
Great. So you mentioned the operation room, and when I was going to med school, it was called the operation theater. I'm sure it is still in most places. Do you know why it's called a theater? What was the reason behind it?
I think several of these probably still exist even in this country, but historically, people would watch surgeries. And so was, you know, I think early on, if you look at some of the documentation, people would just watch from inside the operating room where the patient was, and that was before we fully understood the infectious risk of doing so. And then once we did, we moved to actually a gallery where people could watch surgeries. It's something that doesn't happen almost at all in that way. People watch surgeries if they're in training, but I think there's some real value to that because you get to see what is so important in performing a surgery properly, and I think there's real educational value to it. But it is no longer a theater per se.
Thank you. Thank you, Dr. Naidu, for giving us a glimpse into your world and why you chose your career and what a surgeon's life is like. And now, of course, you also have an administrative role and how healthcare professionals can make a larger impact being in an administrative role. So thank you very much. And we'll hope to have you again and share a glimpse of in terms of what you really learned about life from your clinical experience. So I look
Big
forward to
topic.
that.
Big topic. Thanks, Dr. Bardwaj. It's my pleasure.
Thank you. Thank you.
Take care.